So, good afternoon, everyone. It's indeed a pleasure to be here today talking about a unique concept called as third eye and how to open it. My name is Vaibhav Bagaria. I work as the Director of Orthopedics at the Sir H.N. Reliance Foundation Hospital. I'm also the President and National Delegate of CCOT India, which is the most famous World Orthopedic Society in the world today. So, first of all, at the outset, I would like to thank um, the entire team at RLS for having me here from the Sir H.N. Reliance Foundation. We work close in collaboration, and it is indeed a pleasure to meet all of you here today. So, getting on to my topic of third eye, I'm sure most of you, or can I have a show of hand of how many people have heard about third eye here? So, a fair number of you guys have heard about third eye. And what is it? So, third eye, also known as the inner eye to many of us, is a mystical and historic concept referring to a speculative invisible eye that provides perception beyond ordinary sight. Often people associate it with clairvoyance, the ability to observe chakras, and out of body experience. So we know that an individual can open his third eye with intense meditation, focus, and determination. That's all that is required to open the third eye. And once open, we can do wonders. But what about nations? What about institutions? Institutions like RLS or RFH, from where I come from. And what about various disciplines? I come from orthopedics, and we all here sitting belong to different disciplines. How, as disciplines, how, as nations, how, as institutions, can we open our third eyes? And most importantly, what can be our third eye? So let's look at what are the possibilities and why have I chosen this particular topic of third eye. So to me, the third eye for any of these, and even for individuals, not only just nations, institutions, and disciplines, the third eye stands for research, development, and innovation. It's an acronym, but a very apt acronym that represents the most important aspects of what we do. Why is there a need? Why there is a need for me to even talk about this subject? And I think this slide tells it all. We are on the bottom rung of the innovation index across the world. And our investment in terms of training people, in terms of producing the scientists and engineers, are again at the very bottom of the pyramid. True with the patents. If you look at the country of origin, if you look around, how many of us, I know you guys here at Arlington do a fantastic job and have got a lot of patents. But if we apply it to the whole country as such, you will notice that our contribution in terms of real enforceable patent is quite minuscule. And there's definitely a need to change that. Same goes with the research paper that we publish. Even in life sciences, our contribution is very, very less. And that is all because our investment into the research, development, and innovation is very less. Although you can see that there is some silver lining here that most countries, while stagnating, especially US as a GDP, will continue to stagnate in terms of their investment in research and innovation. India will continue to grow, and at some stage, it will be exponential. We live in an era of hope, and I think with time that will change. Coming to my own fraternity of orthopedics, we just had a bone and joint decade. Last decade was termed as a bone and joint decade. And we know orthopedics is the leading cause of disability in the country and globally. When we talk of India specifically, we have large caseload of spinal tuberculosis and other infectious conditions that warrant attention by all of us sitting here. We are unfortunately tagged as the world's capital of road accidents and death, with unacceptable number of death and disability happening because of trauma worldwide. As a country, we represent 20% of world population, and this percentages keep growing on year. But however, I'm ashamed to say that we do not have a single Nobel Prize in medicine, despite the fact that we have the highest health burden in the world. They say the necessity is the mother of invention. But if we needed it, why is it that the inventions or innovations are not coming in? Why is it that we are still struggling? And how can we change it? How individually and as an institution can we change it? And I think most of you know this. Our innovation, our research, our ability to develop something is based on number one, questioning, number two, observing, number three, networking, number four, experimenting, and number five is associated thinking. If we do all the five, it's only then that we'll be able to develop or deliver something concrete. Some people are only good at questioning. Some people are only good at observing. Some people among us here are good networker. Some people are always good at experimenting and getting out certain things. And some people are abstract thinkers. But we need either as an individual to have each of these five traits, and particularly teams to have these five traits. If a team can do all of that, it is bound to develop world-class products. I always tell that the way forward on how, for any specialty, for anything, is imagination. And world is but a canvas of imagination. And for us, from where I belong, we have been always stereotyped. You are a surgeon, you're not a scientist. And I think people believe that surgeon scientist is an oxymoron. No, it is not. For me, I think as a surgeon, it's even more of a responsibility to be a scientist, because we straddle both part of the world at one go. And I go back to this slide often in my presentation, and I think imagination is more important than knowledge. Knowledge is limited, but imagination encircles the world. And at that imagination begins what can be done or what can be achieved. And it all begins with childlike enthusiasm. If we have the enthusiasm to create, we shall be able to create. The key is to perceive. In order, and the mantra for entire thing of the research, development, innovation, and all of you sit here, and some of you may be worried about your jobs, some of you may be worried about what happens next. And I think in order to be irreplaceable, one must always be different. We all must find a work that we love and ask this question: why is it important to us? Why research is important to us? Why innovation is important to it? Why are we contributing what we are contributing? And we do not need to have to be great to start, but we need to start to become great. So whatever we are doing, if we make a start, I think that's the first step towards greatness. And many of you have already achieved this greatness status. Or if you talk to anyone who has achieved the greatness status, they'll all tell you, start, and it shall happen. We need to ignite fire, not just among ourselves, not just within us, but also among our peers, our juniors, our colleagues, and people whom we meet every day. And I start with three little stories. These are my personal favorite whenever I talk about research and innovation. Michael Urist, Chittaranjan Ranawat, and I'll also talk about our little personal journey on creating certain things. So this is the guy, Michael Urist. I think some of you might be knowing it. If not, I would urge you to read about him. He's the guy who discovered BMP. He was the editor of the most famous scientific journal, CORR, Clinical Orthopedic and Related Research, from staggering 1966 to 1993. Guess who was his mentor? A physiologist. He was an orthopedic surgeon, but he was mentored by a physiologist. He did the first international conference on BMP at Johns Hopkins in his memory in 1994. And what prompted his work? It was long bone non-union. And this guy works at Potato Field, thought how to go about and discovered one of the most important molecules in the field of orthopedic history, the BMP. The second guy, many of you must have heard in media, in newspaper, he operated on Vajpayee, made the knee replacement famous. And to people, he stands on a pedestal which is unachievable. But it is easy to see where he stands, but difficult to comprehend where he's crossed. He was born in a small town in an MP, studied at Shahpur. Today, he has over 400 publications from diverse topics, from hand to spinal abscess. And he's known for joint replacement, not for his hand and spinal abscess. And he's published in all journals across the spectrum, from GMA to JOA. And that's what it is. That you need not be limited, you need not be boxed into a certain stereotype. Your genius may not be limited by what you did in a particular niche field. Although it's important, but it's also important to explore different aspects of science that you come across. We'll also talk about a bit about our little journey with the use of 3D printing. So you'll see this is how 3D printers is one of the technologies that I love, and I have helped and I filed a patent for it, and I put it across. This is a 3D printer in action. It is using a fused deposition modeling concept. They're like jalebi makers, just like the jalebi. They make a shape. The only difference is that this jalebi maker, the way it is turned, is controlled by a software. And in our case, it is a CT images laid on top of each other. And it's a very interesting story because my involvement with this began with simple interaction with another engineer who had come to me as a patient. And we struck a conversation and developed a lifelong partnership. And one day when we were having a cup of coffee, he said, and he appeared quite distressed. And I said, why is it that you are distressed? And he said that, look, Vaibhav, I wanted to create something. I'd given the task to my students, but they are not just able to replicate what I want. And I said, what is it that you want? He said, it's a very convoluted structure with a which will filter tobacco at a particular size and in a particular quantity, and that needs a particular size or a shape of a device. And he had the device with him. He said, look, it's not very difficult, but yet the cross sections are quite intricate and people are not able to do it. So I said jokingly, in a very jokingly, oh, we do have this problem often, like a doctors. Our brains are such convoluted structures. This is far less convoluted. So he said, but yes, you have tools. I said, yes, we do have tools. And we do a CT scan of brain to understand how things work. And I said, chalo, I'll do a CT scan of this product that you have, and you can have the cross sections. And I left it there. But to credit of this guy, he actually went and did research and found that today there are industrial CTs available with BMWs and Mercs, and automobile industries often use the CT scan to detect what is wrong with their cars. And he came back to me that, is it possible really what you said to be done? Can we do a CT of this part? And we did the CT of the part, and he got those images, and he had a 3D printer which he could use to print that whole thing. And fortunately or unfortunately, a month later, we had a patient who had a very complex hip fracture. And then I went to him and asked him jokingly that, I've got a CT scan of a hip fracture patient. Would it be possible for you to 3D print it? And he said, why not? Let me try. And we sat in his lab, and after 3 hours of trying and doing all permutation combination, we were able to print out this 3D printed model of a hip fracture, which was quite complex. And it really made a difference to the way I operate on my patients. It decreased the surgical time from normal 3 hours to mere 40 minutes. And it was transformation. And you will all know that any minute saved in operating room is worth every penny that can be spent. So we were able to do that thanks to this. But the idea or the concept that I want to propose you is that it came about because I interacted with that guy, and the guy was open to that. Professor Kuthe from the VNIT, he was open to the idea, open to experimentation, and open to collaboration. I think most research should start that. And you'll see how it made, this is the final thing. This is you'll see that this is the ileum on the top. This is the acetabulum getting printed. And this machine is spewing out minimal threads, depositing in layer by layer. And then there was no looking back, and we did a lot of complex cases. This is a 20-year-old guy who was only weighing 18 kilos. Imagine a 20-year-old guy only weighing 18 kilos, had a juvenile rheumatoid arthritis at the age of 6. He was walking well till the age of 6, but presently from 6 years of life, he was unable to walk. Doing BCom third year, wanted simple pleasure of life, which is able to walk. And this is a case example. You'll see that the hip joint is completely destroyed. This is literally a pelvis of an 8-year-old kid, and I'm talking about a 20-year-old adult. So it's a very challenging situation for us orthopedic surgeon, because we do not know what kind of bones there will be, what kind of implant would sit in such kind of situations. This is the kid that you will see. This is a 20-year-old boy, but literally looking like a kid here with all the deformities, never walked since last 14 years of life. So we developed this 3D printed model, and you'll see that the whole pelvis can literally sit in my hand. This is 1:1 model. So this is how small or how tiny that person's pelvis is. And when I do a hip replacement, it's a big challenge because I don't know what implant will sit in. So I have to see what size it will sit. So once we printed this model, we were able to kind of do a mock surgery by using the reamers to see what cup size will fit. These are very important critical steps that we do intraoperatively. But because we had this model out of the body, we can literally do a mock surgery and put our implants and check how they are happening. And today, once we did that, we could get him to have an artificial hip that could make him walk. And similarly, we had, and as I said, once we were able to do that, there was no looking back. We kept doing it for more and more complex fractures, printing things, developing and practicing it beforehand, and reducing our surgical time. Next, we went a step ahead, and now we can do a navigated surgeries because we can use these 3D models to create patient-specific jigs that would allow us to execute surgery to the greatest precision. So all of these complex areas which are very difficult to get in, we've been able to do these trajectory guide using the 3D printing technologies. It doesn't stop there. We have been able to use bionic arms to a certain extent, 3D print arm that can be fitted to kids. The next generation came of using this technology for what we called as patient-specific implant, where the metal printing could be used to kind of make the implant which was specifically directed at patients. And today, even at Reliance Industries, we have got these metal printers which we occasionally use to deliver patient-specific implants. The final frontier, and something that will be of interest to all of you, is the bioprinting. I think what I've shown you is a seed step to develop scaffold or print scaffold using bioprinters. Personally, I have only seen it in exhibitions and conferences, but I'm sure that with coming years, and I don't know if it exists at RLS, but I hope and I wish to see this kind of bioprinters very soon at RLS, because I believe it's the technology that we all must invest in. We were able to put that into publications, and those of you who are interested can go and read these publications. We've got a book also on the topic, and of course a lot of publications. So any of you who are interested in 3D printing can read our publication. But my idea here was not to tell you that we are great, but it's a teamwork. It's a teamwork. These are the people from IIT who I was with, Professor Ravi, Rupesh, all of these people who helped to develop the technology, and my own team with whom I work. These are all dedicated people who work and enjoy working on this field of research, development, innovations. People ask us, when do we start we are just beginning our career. Is it right time to enter the research, development, innovation board? And to all of those, I said, the time is now. There is never a right time to do the right thing. Don't wait. Time will never be right. You will have commitments, you'll have things that are more pressing and more priority driven than to be able to never innovate. But stick on, just go ahead and do it. And where do we do it? Most people, when I ask, and when people come to me as a newer residents and I ask them what are their research interests, have they done research? There's always a common excuse that it is not something that they have facilities for. They lack the infrastructure that they need to, and they have frankly been going from one place to other. And I tell them that not all those who wander are lost, and sometimes the wrong choices bring us to right places. You must do what you can with what you have and where you are. So the innovation need not be in fancy labs which are multi-million-dollar investment, but these can be roadside things. Look at this thing that we saw on a road. This is simple garbage dung. I know many people will identify this. These are called as cow dung cakes or goethas. And this roadside people, to store these things, have carved this beautiful painting on it. There's no reason for people to be artistic. There's absolutely no fun in storing these cow dung cakes. But the person who was assigned that task chose to do it. Just like this next gentleman, Mr. Saidullah, and I put this. It's a fun video, but I want you, all of you, to watch this video because I think there is an important lesson for all of us here about what Mr. Saidullah has to say.
नाव का इंतजार मुझे गवारा न था, मुझे मेरे प्यार से मिलना ही था। मेरी बेकरारी ने मुझे आविष्कारी बना दिया। पर प्यार को भी आविष्कार का सहारा लेना ही पड़ता। आविष्कार ही मेरी नूर का नूर है, नई खोज ही मेरी जिंदगी का जुनून है। माई टेक्नोलॉजी।
So you can see that how enthusiastic that person was about developing things. So if you find a passion for creation, you will be able to do that. But a word of caution here. Remember that jugaad is not innovation. We often in India feel that if we are able to just do something, that means we have innovated. No, they are not the same. They are in fact different things. Sometimes we need to create things what we want, be a part of, and with perseverance, patience, and definitely not with shortcuts and jugaad. We need to give it time. We need to cultivate it. Any innovation is like seed that needs watering, that needs energy, that needs effort, and most importantly, patience and love, just like our child. That we, every child, I've got a couple of kids, I've got a daughter and son. Both of them are very different. Both of them have different temperaments. But one thing that parenting has taught me is perseverance, patience, and of course, unbridled love for what you want them to be. They may go in any direction, but it's our duty to create what we want to see them. They may choose different paths, but our perseverance, our patience, not shortcuts, will make them what they are destined to be. We should not complain. And I give this example. We do not complain. People can easily complain about the government setups, the faults. We are here at RLS. It was created out of nothing. It created the journey. It always inspires me when I hear about RLS, about the humble beginning that RLS had at RFH. And I'm sure many of you or most of you would be knowing this story. But the ability to grasp the importance of creating an RLS is not lost to people who are associated with it. So we must not complain about NASA or government agency, but we must create alternatives like SpaceX, Elsevier. We've got numerous examples where people have not complained but created. We do not have to argue about regulations, but create things like Uber. So let's keep building alternatives. Let's keep producing Teslas, Googles, Amazon, Apple, SpaceX, Ubers, Twitters, Facebook, Flipkart, Ola, Scootsies, UTVs, Skyhubs. So we need to continue to innovate as the world needs innovation more than ever. Key thrust area for all of us in orthopedics and RLS also will be bioprosthetic, regenerative medicine, patient-specific medicine, big data, AI, and robotics. So if any of you are interested, specifically when we talk about life sciences and orthopedics, my field, I know that sophisticated science is feasible and can be realized in individual research group. Yet the future is only if we have intensified exchange between basic scientists like you all and clinicians. And all this needs to be fueled by the enthusiasm of talented junior scientists and clinicians. So we must make a team who are willing to go to the extra mile. Specifically, the areas like immunomodulation or musculoskeletal repair, where we understand how small little things make difference to repair, is one area that I would like to see more research in. I would also like to see people working in the arenas of cartilage and disc regeneration. One very interesting area is translational of biomechanical signal into biochemical signals. We all know that loading affects the growth of the joint, How people walk makes an impact on the cartilage. So there's a lot of biophysical signals that our body has, our vision, our sight, our ability to take load, our ability to grasp the ideas. But how are they converted into biochemical signals is something I would like more and more of you to work on. Big data is everywhere. We talk about our chairperson, Sri Mukesh Ambani said, the data is the new oil. And I think one area where big data will make the most difference is healthcare. There are tons and tons of information, tons and tons of data about uh, all the aspects of thing. And I think we are limited in our ability to deliver what we want is because there's not enough processing power. But we are on a cusp. I think this is the decade where the big data will meet big computing. And together in field of life sciences, we'll be able to understand cell heterogeneity in much better form and perhaps deliver patient-specific solutions. One area that is very close to my heart is understanding how chronic inflammation in the elderly work. I call that infla-aging. Infla-aging is inflammation and aging. We know that aging is inevitable, but yet understanding why certain people have more inflammation, why we age yet faster, is there a way to stop aging? I think there is a lot of research in this fountain of youth, and I would invoke every one of you to kind of think and rake this brain in this very important area. And it's not just about aging, it's not just about stopping aging, it's about understanding the repair and regenerative process. Most of you are in that field, and that is why there is need to do more to kind of achieve this understanding in much more in depth. Finally, I would leave all of you with this statement: dream your dreams with your eyes closed, but live your dreams with your eyes open. Open your third eyes, spread happiness, spread health, and stay blessed. This is a slide about Cassandra or Prometheus. So these are characters from the Greek mythology. Prometheus was the one who stole fire from the god and invited ire of the entire the god community. Yet Cassandra is known for her ability to predict future, but she's cursed with the fact that no one would believe what she has to say. So it is up to us whether our future lies in Cassandra or being Prometheus. We need to be both. We need to steal fire from the gods for the betterment of humanity. And we also need to be able to tell the future, but a future that people will believe. I thank KVS sir and the wonderful team at the RLS for giving me this opportunity, and leave it with this verse from Bhagavad Gita, which is chapter 11, verse 8, and which talks about how the God has an ability to give divine eyes to all of us, and what it means, how we can be equipped with divine senses, mind, intellect of God, if we choose to be a part of it. In this journey, we all are, I'm really grateful to my parents, my patients, my partner in journey, my students, my kids, and all the people, and many of you are sitting here who've inspired us to do more than what we are meant to do, but more to what we are destined to do. So thank you, everyone, and I welcome any questions that you may have on any aspect of this presentation. This is a bit of spiritual, this is a bit of academics, and this is a bit of myself. Out offbeat, but I think KVS sir always brings about offbeat things, and you guys are all here, so you know what KVS sir is capable of. Silent yet very powerful. So thank you, sir. Thank you, entire team at RLS, and I look forward to interacting each of you in next couple of hours. Okay, thank you.